Yeah. Annie, could you do a roll call for us, please?
Absolutely. I have myself, Annie Cathy, Cheryl Hartman, Chris Lounsbury, Alicia Beckholtz, Emmy Bristow, Jason Emery, Kaylee Becker, Kyla Leonards, Melissa Fisher, Violet Plummer, Martin Kidston, MCAT, and Terry Kendrick all are online. In admin 206, it looks like we have Commissioners Strohmeyer, Vero, and Slotnick. We have Ann Hughes, Erica Grindy just joined, Allison France. We have Aaron Couts. And
Oh, sorry, can you
You
not
can't
see her?
see her, Annie wants us here.
thank you. Did I miss anybody? Oh, who's in the corner next to Josh? Is that
Eric.
Brian?
Oh,
Brian West.
Sorry.
Brian's here.
Brian West. I can't see Brian. Thank you.
All right, thank you so much, Annie. Do we have any public comment on items not on the agenda? Okay, seeing none, we will jump to the consent agenda, which is robust.
I know, I'm reading through it, sorry.
If you guys want to take a minute and look through and please pull out anything you'd like to talk about.
I move to approve the consent agenda.
Dave reads faster than I do. Second.
All right. Any public comment? All in favor?
Aye.
Thanks a lot. Okay, our first action item comes to us from Heidi West.
Okay, so this is just a request for the board to approve a contract with the Sealy Lake Nordic Ski Club. This is for a $500 micro grant for improvements on the biathlon range, which is part of their larger ski trail system up in Sealy Lake.
It's good to have the word safety and compliance paired with biathlon.
Yeah, absolutely. So
Don't wanna put anyone's eye out.
all the users safe.
Biathlon's all fun and chill. That's-
Well, especially when you have air.
Yeah, I know.
Loves-
I move that I'm really excited that we're able to do this and that they applied. That we approve a contract with Sea Lake Nordic Ski Club. So,
Any comment on this? Public comment? All right, all in favor?
aye.
Aye, yeah. Good job running this program. I'm
Yes.
excited that we can be part of
Super
something,
exciting.
something good and something fun. Aaron,
Well, I have a MOU amendment that we're requesting the board approve and sign with Western Montana Mental Health Center. And this is $100,000 from the crisis receiving center from our crisis diversion grant from the Montana Department of Public Health and Human Services for half of this fiscal year and the next fiscal year.
All of the next fiscal year?
Yeah.
So it's the 1.5
It's
years. Sort of.
basically supplementing some of other funds that the county's already put towards it.
Okay. Do we know when it's opening or?
Terry's on the line,
Oh.
they can answer questions.
Sorry, I didn't
Specific.
realize.
Yeah, I had asked her to come in case there were any specific questions related to the.
I mean, they'd be like bursting excited about
Yeah.
this, so
I didn't
brag about it.
tentatively
Tell
on
us.
us, but I'll let her.
Yeah, go Terry, brag.
Okay, so it's coming along nicely, but the opening we're hoping is going to be September, October. We had a couple week delay, but things are going well. I look forward to seeing it. I think the walls and everything are up, and yes, it'll be open soon.
Oh, I didn't realize the walls had to go up. I thought it was more built
pretty-
than that. Okay.
Major remodel.
Yeah,
Oh,
it was a major
okay.
remodel. And, for a lot of that had to do with safety and, putting in cameras, et cetera. They really kind of gutted the place and started over.
Got it.
Safety and compliance.
Safety and compliance. Yes.
Mhm.
Yeah.
Being put it.
Yeah,
Okay.
Questions?
No, all
How
right,
how many folks do you think will be able to serve?
Terry.
So the maximum at any one time is 16, and that's state law, but
Ah.
there can be more than, there could potentially be more than 16 in per day. So some people won't need to stay the full 23 hours and 59 minutes. And so as long as we have space available, people can come in.
Right,
We'll also refer to Dakota Place so that there really should be 16 plus 5, so that there would be space in the community for 21 individuals.
Great, thank you.
Okay, I move that we approve and sign the MOU.
Second,
All right, any public comment? All right, all in favor?
right,
All right, thanks.
Yeah,
Thanks, Terry.
Thank you.
Thank you.
And thanks to Brian. as well.
thanks, Brian.
Always.
Yes, you all deserve the thanks.
Safety and
Thanks so
compliance.
much for this.
Thanks to
Great.
safety and compliance.
All right, Kaylee.
Good morning.
Hello.
So this item is related to the current active DNRC grant we have for phase 6 of the 9 Mile Reclamation Project. So the reason this is coming forward is that currently the county commissioners are the only authorized representative. So that means you have to sign every little piece of paper that goes out the door for grant reporting. And this action is requested so that Chet Krauser would be able to sign. He would be the authorized representative and would be able to sign primarily documents related to the quarterly grant reporting. Other documents related to, if you wanted to do an amendment or close out the grant or any of those bigger actions would still require commissioner action. This really would just be a change to reporting documents. So
And we
would just
really trust Chad.
No, we cannot.
Hang on to this. Okay.
This is so
You
much
didn't
more
even
efficient.
hesitate.
Yeah.
Thank you.
Huh. I trust Chet. I don't know about these two,
Go on a
but
limb. Go out there.
I move to request the board designate Chet as the authorized representative.
Reluctantly.
Any public comments? All right, all in favor? All
I,
right, thank you.
thank you.
We have 2 items from
Not related to safety.
what?
They are both benefits plan related. So the first is a request for the board to approve and authorize the chair to sign a professional services agreement with Payne West to perform consulting services for the benefits plan. The services included in this almost 3-year or two-year contract, sorry, are benefit plan analysis, which is really just them looking at claims data along with what we're collecting for premiums, analyzing the market in terms of future costs of healthcare. There's a lot of data out there on disease trends and helping us use all of that to project the future for the plan. So primarily the financial health future. They also will often recommend potential vendors that might be able to help us if we're seeing certain issues, like we will talk about in the next item in terms of pharmacy. So they will connect us with those sorts of vendors. The other things they do, really important, they provide our stop loss insurance, which is the excess coverage. That insurance right now comes into play when the plan has spent $450,000 on a single member during one plan year for medical expenses. Anything over that $450,000, this excess coverage comes in. In general, any insurance broker who places that coverage is going to take a fee to place that coverage. This contract eliminates that fee for the broker services. So what I've said each and every time we've talked about this contract is really we would be paying this amount anyways for that broker fee, but we're actually committing the broker to provide these other services for us, which is generally not included in that broker fee.
How much is this contract?
It is $150,000 over the course of, so it's May 1st of this year through December 31st, 2025.
Oh, of 2025. Okay, that's the length that they're going to be doing their analysis and tell us.
Yeah, they do it annually for us. So they come in, our next item on here is about rates. So Payne West
Okay.
assists in looking at that rate work and all of that. So this did go out, obviously went out for procurement. We had one other eligible vendor in the space and both for Montana firms, which is great. Payne West has done this work for a great deal of time, and through that procurement, just seemed better suited to continue working with our self-administered plan. I think that's the key, is understanding what we're up to. So with that, if there's any other questions we can answer.
No, thank you.
I would move that we approve and authorize the chair to sign the PSA.
Second,
Any-
I do have just a quick, how often do we go over that 450? Or how?
Oh, it's unpredictable, but this current plan year, which will end in the end of next month, I believe we'll have 3 potential claims,
Oof.
which will tie into my next.
Okay.
Or do we have any public comment on this? All right, seeing none. All in favor?
I
Aye, thanks.
This next one is a request for the board to approve a 10% medical benefit premium rate increase across all levels of coverage for the Missoula County Employee Benefits Plan, effective July 1st, 2023. So as a reminder, our benefits plan self-administers our medical benefits, dental benefits, vision benefits. This just relates to medical benefits. Services covered under that are pharmacy benefits, along with really anything that we relate to going to primary care, emergent care, any sort of specialty care.
the vision and dental aren't.
Outside of dental and vision.
So if you have an emergent dental, how does?
That is interesting. It can fall under the medical benefits plan. It honestly is all in the billing side of things. So if you end up in the emergency room for a dental emergency, they will take care of the emergent piece of that. If you then need potential future care through the dental office, it could fall under the dental benefit. Just
Okay.
depends on.
Thank you.
Some of it's location of care and some of it is just billing practices. Similar to vision, right? So if you have an emergent issue,
Mhm.
that potentially will fall in. So dental and vision plans are doing well. We don't need to do anything there. Medical plan is not doing as well, hence the 10% increase, which is it's significant. The things that we look at just generally is nationally, the trend for medical expenses are continuing to rise. So I just was looking at it yesterday. I think we're anticipating over 5% increase in medical costs for the upcoming year. We control that through contracting locally. So our facilities, hospitals, locally, we tie our contracts to Medicare rates, which is really important. A lot of contracting is based on billed charges. So it could be, a reduction from the billed charges. That's not a lot of control over how you're going to spend, because the facility then decides how much they're going to bill, and you say, oh, we will pay 50% of billed charges. Well, it's really hard to predict that. So the fact that our local facilities are willing to continue to contract with us for a percentage of Medicare is really important, because the federal government negotiates those Medicare rates. And so those are set at least annually, which is extremely helpful. But we do see this in facilities that are not in our local network. And when someone is traveling and has emergent care, or if they need care that's outside of what we have contracts for locally or with our regional contracts, which go into the state of Washington, primarily with the Providence Network. If someone needs care outside of what can be provided, we oftentimes work really hard to negotiate single case agreements, because otherwise members are going to be subject for the difference between what the plan will cover and what the facility bills. But
Could be
those
big.
contracts, we generally aren't as lucky to get that percent of Medicare. So a lot of times we are paying bill charges. That's not a huge piece of what we're paying, but know that those are emergency visits or high level specialty visits. The plan has seen a rise in disease in cancer treatments and significant cancer treatments. We're also just seeing a change in how cancer is treated, which is super positive for the individuals involved.
What's the change?
So post the typical chemotherapy, radiation therapy, it appears that they're now doing a pretty significant immunotherapy, which is really important. So if you've known anyone who's gone through any sort of treatment like that, it just depletes your whole immune system. And so there's a couple year, immunotherapy that is helping your body build that back up while still hoping to keep all of the cancer cells, out of your body at that same time. It's just expensive. It's new therapy. It's pretty expensive. And then the other piece of this that I know I've talked to you all about previously, last year when we did a rate increase, is pharmacy. We're seeing new drugs come on. Same thing. They're very effective. A lot of these are on an autoimmune disease. So rheumatoid arthritis, Crohn's, psoriasis. The drugs are very effective when they make it through FDA approval, and there's whatever the feds do in terms of the pricing piece of this. The argument from the drug developers is always, well, this is saving this much in medical expenses, so we're going to charge this much for the drug. My argument against that sort of pricing is we have some drugs on the plan that are over $20,000 a monthly. And when does that stop? So we're just not seeing it stop. And so this could be a lifetime of this. Thankfully for members, they have access to that at a fairly minimal cost compared to what the benefits plan is paying. But our pharmacy expenses this year will be almost, if not over, $4 million. I haven't been around this that long, but when I started,
4 million.
hitting $1 million in pharmacy costs was high. So we have seen a 400-time increase, and it's purely because we're seeing these specialty drugs come on the market that are doing really great things, but it's the pricing structure is absolutely wild. And it is one of the things, and I had mentioned it to you all in my department meeting, that I think it's one of the things from our plan. It could be really helpful to reach out to our congressional delegation with some of the data we have on these drug costs and the impact that it's having on our small plan that really benefits taxpayers. So then we're not just coming at it from an insurance perspective, but this is spread across taxpayers. A 10% benefit premium increase, it's felt by taxpayers. And I take that very seriously when I make these sorts of decisions. And frankly, this is probably pretty conservative. I'm not going to sit here and say I won't be back next year, with another increase if
So
we don't figure out a problem.
Erica, is it because of the prescription drug costs because earlier I think you said that you were anticipating a 5% increase in
That's
costs.
the
Was that-
national trend for just health costs overall. So if I go to the doctor, they're going to be increasing their prices by 5%.
Right.
We can control some of that, but I think the bulk of this is pharmacy.
Okay, so just reconciling the 10% with that 5%.
Right.
It's the farm, it's the
pharmacy for the most part. So,
Okay.
and I can pull out where we're at.
And Erica, when you said worth speaking to our congressional delegation,
Yeah, you were just
What-
with Shibu.
yeah, it was just with Shimu. What's a sort of congressional policy fix that would address this? What would that look like?
I mean, I truly think this is where, and this is from an econ undergrad major who is not opposed to the free market, but this is a spot where controlling price is really, really important. I think our medical system, it's, I think having the feds come in and actually apply Medicare drug prices for
Mhm.
private insurers. I mean,
Okay.
or come up with a price where
I would- yeah.
you can't set it above this maximum pricing point, because there's no question that I just think a dive into the books of drug manufacturers, and hopefully this doesn't come back to haunt me someday.
No,
But it's mind boggling to me that a drug should be costing $25,000 a month. And these are individuals who are like active and doing well, and I want them to keep doing well, but like this is not like you're in and something, wildly unknown has happened to you and someone is just like rapidly figuring out what concoction you need to save your life. Like this is an every day, every week sort of drug that you're going to need forever.
I was looking for a couple sentences and I think we got it there. Medicare pricing for.
And it
So-
will probably be quoted.
So let's see if I got it right. Medicare pricing for drugs, for Medicare pricing for private insurers for prescriptions.
There needs to be a cap. Yeah, so for example, we, in fiscal year 2018, we were at about 1.5, just under 1.5 million for drug spend, and we're gonna hit 4 million.
And because we're a public entity,
Our taxpayers.
these taxpayers are covering some of this cost.
And I do want to be clear, this wouldn't, the fact that we self-administer our plan, this wouldn't be any different if we did
Yeah.
a third-party administrator. These are the.
For sure. And I think we enjoy some savings because we are self-administered. So we are doing right by taxpayers by managing our
I hope so.
healthcare plan like this.
Yes. So recommend the 10% benefit rate increase. I do think it's important to make sure everyone knows kind of what that looks like for a monthly total premium, because it still is relative to market. We're still enjoying fairly low premiums, even though these numbers will seem a little shocking. So the monthly total premium for an employee only, which the county covers at 100% employer cost, is $719 a month.
So, but the county covers the
County
county. So for
covers
the
that.
person, it's zero.
Employee pays $0.
That's pretty great for the employee.
For an employee who has their child or children, and that is one thing on our plan. You can have as many children under this. This
Really
level of
great note
coverage.
from Annie in the chat. Yeah, Josh, read it out loud.
And Kathy said, thank you for what you do to fight for us, Erica. Chemo pill prescription, I believe, saved my life. That's pretty powerful. Thank you, Ann.
It is powerful. We appreciate thank yous. My staff does a hard job.
We appreciate Annie, so
Yeah.
thank you.
We were just thinking about Annie being all knowing yesterday.
Yeah.
So employee, child or children is $1,205. Employee, with a spouse or domestic partner, no children, is $1,350. And then a family, coverage, is $1,837. And those are the total costs. This will be, it was provided with the RCA, but it will be posted on the benefits plan website. If anyone has questions,
So-
needs a copy, I can get it.
So for an employee who has a family,
Yep.
children included, that 1,800 a month, how much of that is made up by the employee?
Yeah, so I have it broken down per pay period is how we show it. So each pay period, there's 26 of those a year. The county contributes for a family plan $589.85.
You said 590,
But yeah, about $590. And then the employee contribution is $258 per pay period, so it's about $500.
500 and 1,100. Thanks.
Yeah.
I know I've asked you this before. Pharmacy benefit manager, international arbitrator, which one's worse? It's tough, I know.
I'm sure
U.S. attorney is.
Oh,
I shared this with you. You obviously sense my passion.
We appreciate it.
I just, if there's anything I can do in this space, because I came in not knowing anything about it, but if there's anything I can do to fix this pricing.
Yeah.
Given that it was just with Shibu, if you're all right, I'll just schedule time for you and Shibu to chat.
That would be great.
Fantastic. Yeah.
Yep, and we will pull, we just have so much data at our
Yeah, it's great.
fingertips, which is, I want to use it.
It's great.
You should also meet with Sharon Danes' office.
Yeah.
Yeah. Okay.
Thanks.
Um,
Did we finish this? Did we, I can't.
oh yeah, I move that we approve the 10% medical benefit premium rate increase.
Second. Any public comment? All right, all in favor?
Aye.
Thank you. Thanks for
Yes,
the discussion.
Thank you.
Kyla,
Hi, Commissioners. I just have a quick board appointment for you. The county appointed member, Christine Littig, has resigned from the Affordable Housing Resident Oversight Committee, leaving her county appointed voting seat through May 31st, 2024 vacant. Frank Reed is the current first alternate and was interested in moving to this voting member seat. So this motion would just be to appoint the first alternate, Frank Reed, to fill the remainder of the vacant county appointed seat through May 31st, 2024 to the Affordable Housing Resident Oversight Committee.
Sounds reasonable. I would move that we do just that.
Second.
all right, any public comment? All right, all in favor?
Aye.
Thanks for keeping track of all this. Thank you. So we do have some correspondence.
We do. And I don't know if
Martin's there.
Chad or I don't know if Kaylee's on to speak to this.
So the Holland Lake Lodge is actually me.
Oh,
All right, thanks.
yay, Chris.
Sorry, covering for Chet today. So commissioners, you all had some conversations while you were at the Condon Community Council. And I've heard from constituents pretty consistently that there's concern around the potential of the Forest Service issuing a new permit for the Holland Lake Lodge to a corporation by the name of Powder. And so what this letter does is just request a specific time frame for the public to be able to comment on any permit that the Forest Service might choose to issue through its process. It also specifically asked them to include a provision that would make the facility subject to the county's building code, health regulations and land use regulations that might be applicable for any construction that might occur or any redevelopment that might occur at the site. Under federal law, normally permits have to comply, or special use permits have to comply with health and sanitation, but they don't necessarily have to comply with building codes and other land use. So we're specifically asking that they include those provisions if they were to issue a new special use permit, which again is a process that's handled solely by the Forest Service. The county doesn't have any ability other than this letter that's requesting these things to really weigh into that process.
So just to be clear, Chris, the Forest Service would have to agree to allow us to ask for these permits.
That's correct. They would have to write into their special use permit a provision that said you must comply with local building codes and land use in order for our building codes and land use policies to be applicable on federal.
And the Forest Service, it's their option to agree to do that or not.
Or not? Yeah.
Like,
That is correct. Yeah.
Martin, are you still on?
Yes, I am.
Is that clear to you?
Yes, it is. Thank you.
You.
Well, this seems like a good thing to do.
Yes, absolutely.
Yes.
We will send this letter off.
thank
What
you.
about sending a copy to the community council?
Oh, that's a great idea. Could you?
Yes,
help with that?
please.
And
Send
and
it
can
to-
we send a copy to Martin and to Zillian
And Pathfinder.
and Pathfinder?
It'll be in
Good
the
job.
packet, I believe, online, but Martin, would you like a copy sent to you?
That'd be great. Thank you.
Do that?
Yeah, and to Zillian and the Pathfinder. I think those are especially important.
I mean,
Pathfinder
we might as well
especially.
just send it to all community councils because like, I don't know of one community that's not interested in this.
We also talked about just posting it on our social media so that constituents know that we're
Let's do all, can we do all the
All
above?
of the above.
Thanks. Thank you.
And
for
it's
that.
been sent to Powder too, correct? And like,
I think it's been sent to anyone, yeah.
Yeah.
Not yet, but can we get, do we have a contact there to send things to?
yeah, Stacy, right?
I don't know.
Yeah.
Okay.
Thanks.
You bet.
Okay, unless we have something else, looks like we're done. Thanks, everyone.
Thanks, everyone.
Thank you.
Thank you.